Thank you, Sir Ray, for that knowledgeable discussion. So for sure our participants were able to learn a lot, no? So now let's have a short icebreaker. Alright? So sino gusto ng ng games dito? May prepare kami, guys. Gusto niyo ba? Say yes kung gusto niyo sa chat box. Ayan, ang dami. All right. So, Jay will be the one to facilitate the game. So, Jay?
Alright. So, maganda yung game natin today. For sure, ma-excite kayo sa prize natin. So, our game is called Linya Linya, where I will be reading famous lines from TV shows na napapanood natin sa HBO or sa Netflix. So, sa mga nagpupuyat dyan para manood ng mga series. So, this game is for you. So, instructions lang. After I read the famous line, you guys need to wait for my go signal. So, mag-1, 2, 3 ako, go. And Kai will also be assisting me. Magta-type din siya sa chat box natin. So, after our go signal, dun lang kayo magta-type ng hula nyo na anong series. Alright? So, again, wait for the go signal. After ng go signal sa chat box, yung first two na makakatama ng sagot, yun yung magiging winner natin. Again, you need to wait for our go signal. All right. So our prize for today will be a book written and published by Sir Ray. So Sir Ray, would you like to share or tell us something about the prize? Sir Ray? Baka nag-take ng break si Sir Ray. All right.
I'm
So,
here, I'm here.
yes, sir. Yung natin, yung prize natin for today.
Oh yes, oo. Ano yan? 3 years in the making. Okay, and I think we're giving away, this is full color yan, each page colored lahat, and then maganda yung framework. It's using the check framework, which I popularized, and then we're giving away several copies today, but there's going to be a global launch because my program is now present in 61 countries. So we would want to inspire nurses to pass their tests, okay, and push their career towards greater heights. So, ayan, as our way of saying thank you, lalo na yung mga nagsayang ng oras na sumama sa atin. Hindi naman. Hindi naman. So, mamimigay tayo ng, I think 10 copies yung ni Sir Miko.
Yes.
But we'd like to invite everyone. There's gonna be a global launch of the book in May. Oo. So we will give more copies of this in May for the global launching. Okay? So, ira-raffle nyo na po ba ito ngayon?
Yes po. So,
okay,
very
go
exciting.
ahead.
Okay. Exciting yung prize natin today. So, there will be 2 winners for each question. So, we will be having 10 winners sa game natin today. Kasi I'll be giving 10 lines for our game today. So, for the winners, please message your panelist or i-comment nyo sa chat box for our panelists na makuha yung contact number nyo para ma-coordinate namin and mapa-ship and mapadala namin yung book sa inyo. Alright? So I think we should start. Can you please comment ready sa chat box natin if you're ready to win? Alright. So dami na ready.
Sige na sila, Jay.
Yes. So ready to win. Okay. So yeah, let's start for our game for today. So first, yung first line natin. Next slide, please. All right. So, smelly cat, what are they feeding you? All right. Again, wait for my go signal. So, please type in your answers in 1, 2, 3, go.
Ayan, ako. Hanapin natin yung
Paano nyo pa malalaman yan? Dapat wrong spelling, wrong. Yung iba, walang S.
Yung sumagot ng after ng go. Sana ba yun?
Sige.
Ako, ang dami.
Alam ng lahat eh.
Oh, nanonood lahat.
Nagpupuyat.
Nanonood lahat. Oh, there you
Nagpupuyat.
go. First is Therese Ann. Therese Ann and Mariel Alexa.
All right.
Ayan.
So, Cherise and Mariel. Tama ba? Mariel Alexa.
Mariela Alexa.
Mariela
And
Alexa.
Therese Ann. Yes. So, please, yung contact details natin,
That's right.
pakisend sa panelists. All right. Next.
Mhm. Yes, please comment yung full name and yung contact number. All right. So for a second one, okay, a Lannister always pays his debts. All right. So for sure, maraming fans dito. So please type in your answers in 1, 2, 3, go. Dapat complete title. Alright, alam ng lahat. Sige, so hanapin muna namin yung winner
Ang
today.
dami naman.
Ayan, nagkagulo na.
Kung pwede lang lahat manalo.
Alam nyo, para mas madali siyang makita, kasi may mga nagta-type before, siguro lagyan nila ng, apart from the title, the specific word that you will mention after the word go. Like for example, di ba? For example lang go, tapos write Maria. So dapat yung sagot niya should be the title and then Maria. So you can differentiate kung nag-type siya before or after ng go.
Okay. Okay. So dapat may go. Tama po ba? May go, then the name, yung answer nila. Sige, next time. Yung next natin. So,
Oo.
for our winner,
Ito na yun. Ako, ang dami. Teka lang ka.
hindi pwede yung GOT lang. So,
Shortcuts.
yung tamang sagot is Game of Thrones. Okay. All right.
All right. It's here. It's Gentrix, Virgil, Barcarce, and Arviza Wahid. Gentrix and Arviza.
All right.
Send your
Okay. So,
details.
so please comment. Please message us, yung panelists, for the for your message nyo kami sa anong contact number nyo and full name para ma-coordinate natin yung pag-ship or pagpadala ng book nyo. All right, for our next for our third line. All right, you don't want money to just buy things. You want money to be free, and freedom is expensive. All right, so again, wait for our go signal. So I think you should type go, then your answer. So in 1, 2, 3, go. Wala pa akong go signal. Dami na nag-a-answer eh. All right. So for a while, hanapin muna natin yung ang dali lang ng game namin, no? Ang dali lang manalo ng book ni Sir Ray. Namimigay si Sir Ray eh. So for our winners today, for this for our third line would be all right, so our winner for today is Karen Q. We're not sure, hindi mabasa yung last name. And Angelica Rianyo. All right. So Karen and Angelica, can you please message us with your contact details? Okay. So for our Next slide, please. Okay, so life is not fair. Some people have to walk on unpaved roads their entire life, while some run at full speed only to end up at the edge of the cliff. All right, so can you please type in your answers in one, two, three, go. I see one right answer. Okay, so yung first na nakatama ng sagot is Julius Caesar Caliado. All right, so Julius, congratulations. And Vanya Garcia. All right, so again, please message us with your contact details. All right, so for our last one na lang. Last one. Next slide, please. Okay, make yourself heard, whatever it takes. Just find your voice. And when you do, fill the damn silence. All right. So in one, two, three, go. Okay. All right. Yan, may nakita na akong right answer. Sige, for a while.
So we have Carlos, uh, Carlos Gabriel Malaluan, and let's see, and Carl Jason Layson. There. So guys, please send your complete names and number.
Mm-hmm. All right. So yung tamang sagot is Grey's Anatomy. All right. So, Kai?
All right. So yeah, guys, thank you for participating sa game. So kung pwede lang sana manalo lahat, no? Tapos mabigyan lahat ng book. Sige. So yeah, thank you again. And just a reminder, please send your complete name and number para alam namin kung sino or saan natin ipapadala yung mga prizes niyo. All right? So now let's move on to the next part of the program. So Andrea will introduce our next speaker. Andrea?
All right. So for our next speaker for today, she is the chair of the Professional Regulatory Board of Nursing from August 23, 2017 to November 5, 2020. Under her watch, the Professional Regulation Commission awarded the 2019 Most Outstanding Professional Regulatory Board to the Professional Regulatory Board of Nursing. She is an experienced nursing faculty member and administrator. She was elected chair of the LCM 2018 Committee on the Leadership and Management Change at Sukhothai Thamatitat Open University in Thailand. She was the official Philippine delegate to the 26th, 27th, and 28th Association of the Southeast Asian Nations Joint Coordinating Committee in Nursing held in Thailand, Myanmar, and Brunei Darussalam. In 2019, she was the presiding officer of the 29th AJCCN meeting held in Manila. She is a member of the Sigma Theta Tau International Honor Society for Nursing, the Phi Beta chapter, the Honor Society of Phi Kappa Phi University of the Philippines chapter, where she was elected for academic excellence, and Honor Society of Pi Lambda Theta of the University of Santo Tomas Graduate School chapter. She received the 2018 Gintong Mina Award in the field of education given on the occasion of the centennial year of the Municipality of Teresa Rizal, the 2010 Outstanding Philippine Women's University Alumni Award in the field of service and education, and the outstanding doctoral dissertation for the school year 1997 to 1998 from the University of the Philippines College of Education and Department of Science and Technology Science Education Institute. So she finished her Bachelor of Science in Nursing from Silliman University, her Master's of Arts in Nursing from the Philippine Women's University, and her Doctor of Philosophy in Education from the University of the Philippines, Diliman. She presents and consults extensively on nursing curriculum revision, continuing professional development, and outcomes based education. So, ladies and gentlemen, please welcome Dr. Glenda Arquiza. Hi, Doc Glenda. Good morning.
For
Yes, so
that
how are you
very
doing? Yeah.
generous introduction. Okay. Morning, everyone. Magandang buhay. You know, Dr. Ray's presentation is always a hard act to follow. So I hope uh, you will not expect the same the same excellent presentation from me. No? Okay. But anyway, uh, my topic is outcome-based education as a framework for the nurse licensure examination. But for this, when is your NLE? In June? No, but anyway, I think the test framework for the June NLE will still be the 11 key areas of responsibility. No? But I will present to you how OBE questions are crafted. So, good day, everyone. So, what do you mean by outcome-based education? Beginning school year 2018, and I think this is the time that you started your BSN program, no? So beginning school year 2018, the OBE curriculum for higher education, including nursing, was started. The legal basis of OBE is CMO number 46, series of 2012. The rationale for OBE is that globalization resulted to a shift in contemporary education discourse from education to lifelong learning, a shift from education as a transmission of expert knowledge to education as building competencies, including learning how to learn. The goal of lifelong learning is retraining and learning new skills or competencies that would enable individuals or like professional nurses to cope with the demands of a rapidly changing world. So OBE is a student-centric methodology of teaching and learning that focuses on measuring student performance. Note the word measuring student performance. So meaning this focuses on the effectiveness of nursing education. And one of the measures of an excellent education is the result or the performance of the graduates in the nurse licensure examination, for example. Okay, so let's have some examples. Or before I go to the examples, I would like to emphasize that OBE begins with the end in mind. The end in mind. So envisioning, the first question asked is, what do we want our graduates to be? So, meaning what attributes you want to develop in your students or in your graduates, rather. So, this is in terms of attributes, no? So, what are the attributes of a graduate, for example, of Far Eastern University Institute of Nursing or UST College of Nursing or PCHS College of Nursing? So when you say attribute, this is the inherent characteristic, a word ascribing a quality. So it is an adjective. So again, note the word quality. So if a school has a very good performance in the nurse licensure examination, then it has a quality. No? So a graduate attributes are the qualities, skills, and understandings a university community agrees its students should develop during their time with the institution. So in other words, the attributes are the learning outcomes. What the graduates can do, what the graduates can demonstrate after graduation when they go to the workplace. Okay. Spady, who is considered the father of OBE, said that learning is not significant unless the outcome or the learning outcomes reflect the complexities of real life. That's why you have the related learning experience so that you can see these situations in real life. Okay, and uh, if the learning give prominence to the life roles that learner will face after they have finished their formal education. So what can you demonstrate after your graduation? Okay, so let's have some examples of its application in the nurse licensure examination. I will use as framework the 11 key areas of responsibility of professional nurses. So this will be in terms of outcomes and indicators. So outcomes are actually the competencies in terms of knowledge, skills, attitude, and values. So when you say indicators, these are the specific items of information to track whether an outcome has actually occurred or has actually been achieved. Indicators describe observable, measurable characteristics of changes that represent achievement of outcomes. So if you are familiar with the Philippine Professional Nursing Practice Standards or the PPNPS, you would notice that a standard consists of competencies and performance indicators. So let's begin. Okay. The first key area of responsibility is safe quality care. Again, I would like to emphasize that there are 11 key areas of responsibility as the framework for the nurse licensure examination. I guess this will be uh, the last NLE that will be using this framework, because after this, the Board of Nursing is supposed to be using the outcomes-based framework, no, based on CMO number 14 series of 2017. There are 14 learning outcomes under the CMO, and that 14 learning outcomes have been harmonized with the 11 key areas of responsibility and with the 2012 National Core Competency Standards resolution of the Board of Nursing. No? So again, your NLE will still be using the 11 key areas of responsibility. So the first area is safe quality care. And I think this comprises the 60% of the NLE. No, there are 500 items in the NLE, and 60% of this will be on quality, on safe quality care. The others consist only of 10% or 5%. Okay, so for the outcome, sets priorities in nursing care based on patients' needs. So what is the indicator of this outcome? Again, the outcome is in terms of competencies, no? Either knowledge, skills, or attitude. So the indicator for this outcome is identifies the priority needs of patient. And as I said, the indicator should be observable and measurable. Okay? So sample question for safe quality care. Which of the following is the priority of the nurse in the care of the terminally ill? So what's your answer? Freedom from pain, privacy, nutrition, body alignment. Okay. Okay, the answer is A. Very good. Okay. So, the answer is freedom from pain. The rationale for this is that provision of comfort is the priority in the care of the terminally ill patient. As you know, terminally ill patient, especially when it is a case of cancer, pain is the most significant problem. Okay? The next area of responsibility is communication. Okay? The outcome establishes rapport with patients, significant others, and members of the health team. Indicator spends time with the patient to facilitate conversation that allows patient to express concerns. Okay, question. Which of the following interventions is appropriate for a patient with dysarthria? A. Encourage the patient to elaborate on his concern. Provide adequate time for the patient to respond. C. Stay with the patient all throughout the shift. Ask the patient to call you if he needs something. The answer is, what's the answer? Any other answer? Okay. Mr. Nicolo, Liana Sari, congratulations. Yes, the answer is B. Miss Baguio. Okay, Miss Porlagda. Okay, B. The answer is B. Provide adequate time to patient to respond. Okay. The rationale for this is patients with dysparthia have difficulty expressing themselves. So you provide time with adequate, you provide them with adequate time to respond to you. Okay. The third uh, area of responsibility is collaboration and teamwork. Dr. Ray has discussed this excellently. Okay. So, an example of an outcome with regards to collaboration and teamwork is collaborates plan of care with other members of the health team. Again, Dr. Ray has excellently differentiated what you mean by multidisciplinary, transdisciplinary, and interdisciplinary. We are using now the transdisciplinary term, as you can see in the PPNPS. Okay, I hope all of you have a copy of the PPNPS. It is a resolution crafted by the Board of Nursing, and it was printed into a monograph by the PNA, and it cost 50 pesos. But it is in the PRC website. No, because you can see here the standards. No, there are 4 domains of the PPNPS. For each domain, there are sub-standards, and for each standard, there are competencies or outcomes, and then the performance indicators, which you can use as guide for example, uh, crafting performance evaluation for staff nurses. Okay, the indicator for this outcome is refers patients to allied health team partners. Okay, the parents of a patient with rheumatoid arthritis should be referred to a physical therapist, B occupational therapist, C geneticist, D psychologist. The answer is okay. Okay, Miss Panganiban, you are correct. Mr. Layson, Mr. Mariano. Okay, so the answer is B, no? Occupational therapist. Again, Dr. Ray has differentiated occupational therapist from the physical therapist, no? And from carpenter and swimmer. Okay. The rationale for this is the focus of occupational therapists is to assist the patient uh, to regain functions of the small uh, uh, from the fine motor skills, no? So in patients with rheumatoid arthritis, the inflammation in the fingers can make it difficult to for uh, the patient not to engage in activities requiring the use of fine motor skills. Okay. Okay, then the next key area of responsibility is health education. Okay. Outcome collaborates plan of care with other members of the health team. The indicator provides reassuring presence through active listening, touch, facial expression, and gesture. And the sample question, the most effective way of reassuring patient is through A, staying with the patient, B, being available when needed, C, active listening, D, observing the patient? The answer is yes, Miss Galvez, Miss Dumo, Miss Violeta, Miss Dumagay, Miss Subida. The answer is C, active listening. No? So this is the most effective way of reassuring the patient. Okay? Active listening. So I hope you know what active listening is. Okay, we'll now go to legal responsibility. Okay. An example of an outcome for this key area of responsibility is adheres to practices in accordance with the nursing law and other relevant legislation, including contracts, informed consent. The indicator complies with required continuing professional education or CPD units. No? Okay. What is the basis for our professional nursing, the scope of professional nursing? Huh? The basis is the nursing law, no, and other relevant legislation. So what is the present nursing law? RA number, oh, very good, Ms. Tagaw. Okay, RA 9173. Okay, the question is, mandatory continuing education units or CPD units, no, is required for a minimum of how many units annually? A, 10, B, 15, C, 20, D, 60. Okay, yes, Miss Aldaba. Yes, Miss Salomon. Yes, Miss Sari. Okay, Miss Autinko, yes. The answer is B. You are required to have 15 units before you can renew your professional identification card. You are not renewing your license. You have only one license until you die. Now, when you pass the NLE, you will be given a certificate like this, no? Uh, a certificate which is larger than your diploma, no? It's quite large, no? Certificate which is signed by all the members of the Professional Regulatory Board. Again, what you are renewing is the Professional Identification Card or the PIC. And as of now, the mandatory requirement is 15 CPD units. Okay, there are a lot of sources for the CPD units, especially when the pandemic strikes. Okay, initially uh, the board recommended 60 CPD units because we believe that there are a lot of new issues, new technologies for the healthcare system. But of course, you know that the CPD law is one of the most controversial laws. In fact, it's still being revised, no? Because there was a clamor to repeal the law. But since this is a requirement of the ASEAN, then we can, and then of the international community, then we cannot get away with it, no? 15 actually is very minimal, no? Okay. The Board of Accountancy requires 120 CPD units. Under the law, no, under the CPD law, the requirement is 45 units, but the regulatory board has the uh, authority to craft or to require its own requirement, no? Its own number of CPD units, no? But because of all the issues regarding CPD, then the PRC has decided to just give, require 15 CPD units, no? Okay, there are about 46, I think, 46 regulatory boards under the PRC. There are two professions that is not supervised by the PRC, and that is the law, which is supervised by the Supreme Court, and then the marine engineers, which is supervised by Marina. Okay, so the sixth is ethical moral responsibility. Okay, an example of an outcome is adheres to the national and international code of ethics for nurses. Indicator adheres to the code of ethics for nurses and abides by its provision. Okay, sample question. Which of the following actions is ethical? Okay. A, accepting a gift from a patient. B, disagreeing with a doctor on the patient's treatment. Uh, C, not renewing one's license. D, accusing a fellow nurse without basis. Okay, so the answer is, what is the answer? B. Yes, Miss Ole. Yes, Miss Kanin. Yes, Miss Aquino. So the answer is B. Disagreeing with the doctor on the patient's treatment. The rationale for this is disagreeing with a doctor's treatment uh, indicates the assertiveness of the nurse. No assertiveness, no, not arrogance. Okay? Okay, because you may say that oh, that nurse is very arrogant, disagreeing with the doctor. No? But disagreeing with a doctor on the patient's treatment is an indication of the nurse's assertiveness based on her knowledge. That's why knowledge is power. No? You can agree or disagree with the doctor as long as you have the knowledge on the condition of the patient. Okay? And then you have personal and professional development. Okay? An example of an outcome projects a professional image of the nurse. Indicator demonstrates good manners and right conduct at all times. Again, I would like to emphasize that under the PPNPS, there are a lot of outcomes for its domain, no, and for its substandard. And there are a lot of indicators. That's why I'm I'm encouraging you to get a copy of the PPNPS so that you will have a good grasp of what we are talking about. Okay, one of the functions of the Regulatory Board of Nursing, I know that akala nyo ang BON nagagawa lang ng test question for the NLE. No, the Board of Nursing has other functions like hospital visitation, no? And one of the first question that we ask the nursing service department is, do you have a performance evaluation? Okay. So, it is sad that most of the nursing service do not know the importance of nursing standards, no? They are not aware of the PPNPS, no, or the Philippine Professional Nursing Practice Standards. Okay? This is supposed to be the Bible for nursing practice. In there, the competencies expected of a professional are older. No, the competencies and the performance indicators. Okay. So the sample question: when a patient shouts at the nurse should A, shout back at the patient. B, remain calm and assess the situation. Call the board of nursing. D, remain silent. The answer is yes, Miss Layson, Mr. Layson. Ang galing ni Mr. Layson, laging tama sagot. Yes, Miss Jessica. Yes, Miss Alangyani. Miss Balura. Miss Rialde. Okay, the answer is B. Remain calm and assess the situation. No, the action demonstrates good manners and right conduct. By the way, the basic education has included again good manners and right conduct in their curriculum. Okay. During our time, this is emphasized, no? GMRC, good manners and right conduct. Okay? The next is records management. Okay? Observes legal imperatives in record keeping. Observes confidentiality and privacy of the patient's record. The sample question: which of the following is allowed to read the patient's chart? Lawyer, patient's cousin, pharmacist, the patient's parents. What's the answer? Okay, so far. Okay, the answer is yes, Miss Labios. The answer is C, pharmacist. Okay, so the pharmacist, I meant to protect the patient's privacy, uh, only the members of the healthcare team assigned to the patient, like the pharmacist, is allowed to read the patient's chart. Okay? To some extent, the lawyer may be the lawyer of the patient when there is litigation, no? But under normal circumstance, it should be only the pharmacist, no? Because uh, the others, no, other options are not members of the healthcare team. Okay, the ninth key area of responsibility is management of resources and environment. Okay, outcome: ensures functioning of resources, checks proper functioning of equipment. Okay? Sample question. Which of the following actions is a priority of the nurse before amniocentesis is done on a patient who is 24 weeks pregnant? A. Increase the patient's fluid intake. B. Administer IV fluids. C. Check the ultrasound device. D. Ask the patient to perform deep breathing exercises. Yes, Miss Denise, Miss Talura, Mr. Salcedo, Mr. Kalisay, Miss Riskid, Miss Lamonrena, Mr. Aplin. The answer is yes, Miss Paisa, Miss Lialde. Now the answer is C. Check the ultrasound device. The rationale is amniocentesis is an ultrasound guided test. So the nurse should see to it that the device is functioning very well, no? So that uh, efficiency and effectiveness can be achieved, no? Walang mga delay, no? Because the device is not working. And this often happens. So when you are assisting in an equipment assisted exam, be sure that the equipment you will be using is of good condition. Okay? The 10th key area of responsibility is quality improvement. Okay? Outcome identifies and reports variances. Indicator documents observed variance regarding patient care and submits to appropriate group within 24 hours. Okay? Sample question. When untoward reaction occurs in patient due to wrong medication, an incident report must be filed within 1 hour, 24 hours, 48 hours, 72 hours. Yes, Miss Hoves. Yes, Miss Aldaba. Yes, Miss Paisa. Yes, Miss Castro. Miss Andales. Yes, Miss Lucenia. Yes, Miss Arevalo. Yes, Miss Igonia. The answer is B. Yes, Miss Tiadir. The answer is B. No? Within 24 hours. And the last key area of responsibility is research. Okay? Together with community health nursing, research is the most hated subject of nursing students. Am I right? Diba? You hate research as much as you hate community health nursing. But I hope you will learn to love these two areas because these two areas could be the most fulfilling areas or field of nursing. No? Okay? So, after you have taken or you have passed the NLE, I hope most of you will go into community health nursing. Okay? Okay. Outcome disseminates results of research findings. Okay. Research findings are useless unless they are shared with others. So research utilization is very important, especially for evidence-based nursing. Evidence-based nursing practice is one of the 6 competencies expected for a 21st healthcare professional. Na? Evidence-based practice together with informatics and for others. Okay, the indicator able to talk about the results of findings to colleagues, patients, family, and to others. And, oh, sorry. Okay. The sample question for research is the best method to disseminate the information generated from research by a beginning researcher is through A, forum, B, poster presentation, C, colloquium, D, nursing convention. Okay, the answer is okay, yes, Miss Sinove. Yes, Miss Bigero. Yes, Miss Kahoot. Yes, Miss Baisa. Yes, the answer is D, Miss Balura. Okay, Miss Pole. The answer is B, no? Nursing conventions. Okay. The best method to disseminate information gathered through research is through a nurses convention, as it allows the beginning researcher to interact with a live audience. Okay? So meaning you have more people when you are in a nursing convention. Okay? So thank you for listening. Uh, Dr. Ray has given you his inspirational poem, Do Not Quit. I think that is Do Not Quit. I know that is one of my favorites, especially when my cousin, who is now a very good dentist, is the one reciting that, you know? Okay? But I want to uh, to give you 2 stanzas of my favorite poem, which probably is a very good guide, no, uh, for you, no, to pass uh, the board exam, okay, or the nurse licensure examination. Okay, these 2 stanzas are from my favorite poem Invictus by Ernest O. Henley. Ah, okay, which says, I am the captain of my soul. I am the master of my fate. So, whether you pass or not, you and you alone is responsible for it. But I hope that uh, with the Gapuz Review Center, no, as your preparation for the NLE, I'm sure all of you will pass. No, so I wish you good luck, but couple it with prayer and just trust and have faith in our Creator. Thank you and have a blessed weekend. Thank you. You
All
may have some
right.
questions, no? I am willing to answer it, but not what
Yes.
will be given in the test exam, no? Okay? But like there are some issues in the board examination, like usually they say, ang dami-daming research, no? Yes, you expect that at least there are 25 questions related to research and evidence-based practice, no? Because there are 5 practice tests, and for every practice test, there are 5 questions related to research. So 5 times 5 is 25. Okay? Thank you.
All right. So thank you so much, Dr. Arquiza, for imparting your knowledge. I can see naman that the participants are very participative po sa mga questions nyo. So for sure, it helped a lot yung future RNs natin. So yun, as what you've mentioned po, we will be having a question and answer portion. But before we start yung Q&A natin, I would like to encourage everyone to fill our post-event evaluation form. We would appreciate your feedback sa masterclass natin today. So the link of the form will be given sa chat box natin. Alright? So, yun, we will be having our question and answer portion. Please type in yung questions niyo sa Q&A box natin and not sa chat box para mas madali namin makita. Okay? So, first, we have a question here from Meljun. So, Sir Ray, meron po, meron po bang for a while? Yan. Sir Ray, meron po bang evening session dyan sa final coaching or morning session lang po yan?
I'm sorry, I didn't get it. Medyo unstable yung internet ko, kaya I'm turning off my video. Can
Alright,
you repeat the question again?
yes po. Sir Ray, meron po bang evening session dyan sa final coaching or morning session lang po?
Yung evening session. Okay. There's usually a delayed telecast. And then somebody is asking if they can request daw the recorded copy of our sessions. I think yung recording natin will be made publicly accessible at some future time. Tama? So we don't provide individual links, but it becomes publicly accessible. Tama ba ako?
Yes po.
Okay.
Okay. All right. So, Kai, our next
Yes,
question.
our next question from anonymous attendee to Dr. Arquita. What is a good reference book po for research?
Good reference book for research is, I'm partial with, yes, yeah, wise dom, wise domi. No, but I think most of the schools use Polit. But as I've said, I'm partial with Niwas Domi, no, because very simple. But I don't know if there is a new edition, no, because yung ano ko uh, yung copy ko is noong pang 1990s, no, given by Dr. Arugay, who was then the Dean of the PWU College of Nursing. But maybe Sir Ray would be more knowledgeable about this because he has been reviewing for some time now, no? There are a lot of uh, even local authors for research, no? But Polit will be good, no? Okay.
Yes, I agree with Ma'am Arquisa. That's a very good reference. Pero yung tanong niya na what is a good reference, it really depends eh. Sometimes
Yeah.
the verbiage could be difficult for beginning researchers. So you may want to begin with the handouts of your mentors or professors so that you have a general understanding of it, and then
Yeah.
expand by reading Polit and Hangler. Mm-mm.
Yeah. That's right.
All
But
right. So,
you just follow the research process, no? Like formulation of the question, na? Okay. Uh, ang evidence-based nursing is usually integrated in research, no? Okay, so yung formulation of question, no? If you use the PICO model used in evidence-based nursing, no? You know, the situation always start with a clinical condition. No? So you use PICO model. P for population, I for intervention, C for comparator, and then O for outcomes. So when you formulate questions, these four elements should be uh, present, no? The population, the intervention, the comparator. Comparator is alternative intervention, no? And then the outcome, no? The outcome is the result of the research, usually. Okay? So you just follow the research process, no? So that you will be guided. So ano yung formulation of question. So si Sir Ray, naiano niya kanina yung quantitative saka qualitative, no? Maganda yung actually I was listening, no? And you know, siguro during our time na merong kaming ganon na, na ano no na concept or method, baka pareho rin kami ni Sir Ray na ano kami, ano ako, top notcher.
Nako, si ma'am naman. Ma'am, meron pong tanong dito. Alam ko kailan po makakasagot nito. Tama pala yung ano, just to second the motion of Dr. Arquisa. Tama yun, yung PICO. Sa US, ma'am, may dagdag sila doon, naging PICOT. Dinadagdag nila yung time.
Yes,
Oo.
time
Oo.
bank. Yes,
Pero ito, ma'am,
that's
may
right.
sagot dito. Paano daw ba mag-compute ng rating? Kayo ba, ma'am, ang nagko-compute ng rating o yung statistician?
No, the board usually agrees on the passing rate, na? Okay, based on the results. So we deliberate, no? And then we are guided by the statistician, no? Okay, for example, like what will be, you know, based on the item analysis, no? So it's the board that decides the passing rate. But no, the passing rate is usually, di ba, 70, it's 75, no? But, you know, based on the results, we agree, ano ba, baba kami ng 2 points or tataas kami ng 2 points, something like that. Huh? So we are guided by the statistician. So you can be sure that our decisions are scientifically guided, statistically guided. Okay?
Okay, thank you, ma'am. Ito, ma'am, may I ask daw po, what does PPNPS means? Diba, Professional Practice Nursing Standards. That's your professional practice standards. Nasa website po yun ng PRC. Tama, ma'am?
Yes.
Oo. Under each specialty organization, meron na rin pong ginawa eh. Kasi,
yes, because this is required in the career progression and specialization program, no? Okay, of course, Dr. Ray will be very familiar with this because he was the consultant of ORNAP, which is one of the specialty organizations that have one of the first, no, that have this. Uh, These other standards were taken from the mother statement, which is the PPNPS, no? And then uh, parang uh, they take into consideration the uniqueness of the specialty organization, no? Okay, so what is the focus of the uh, OR, for example? The uniqueness of the practice is integrated, no? But their guide is the PPNPS.
PNPS. Ma'am,
Okay?
meron pong tanong dito. Elaborate about malpractice and negligence. O, pwede ko bang isimplify ito, ma'am, para sa kanila? Ito usually kasi,
Yeah, ikaw
they,
na. You are
I,
good at it.
I know kasi, ma'am, kahit ako nung estudyante, pag sinabing malpractice, sasabihin lang, professional negligence. And then kahit ako would wonder, ano ibig sabihin nun, di ba? So mag-umpisa tayo dun sa konsepto ng ano ba yung negligence. So act of commission or omission. Ibig sabihin, mayroon kang nagawa na hindi mo dapat ginawa or meron kang hindi nagawa na dapat mong ginagawa. Now, kung yung nakakommit ng omission or commission ay isang tao na hindi lisensyado para magprotekta ng safety ng pasyente. So ibig sabihin yung unlicensed assistive personnel, nursing assistant, di naman sila licensed to provide care. So ang kaso nun ay negligence. Okay? Ngayon, kung yung tao lisensyado, professional, so ang kaso nun, malpractice. So we take into consideration now yung elements ng crime, like for example, duty, breach of duty, causation, and injury. The most important there is injury, which means kailangan the thing speaks for itself. Di ba, ma'am? Res ipsa loquitur. Nakita mo, may resulta talaga, masabi mo, naging negligent yung healthcare worker. Ngayon, kung wala yon, may hihirapan kang ipanalo yung case sa negligence. So, negligence, pagka the person involved is of ordinary prudence. Ibig sabihin, hindi niya pinag-aralan yung safety requirements of a professional caregiver. Okay? So, yun ang ibig sabihin ng ordinary prudence. Pagka naman ang kaso ay malpractice, it involves yung tao na nag-aral at duty-bound kasi lisensyado na sana ay maprotektahan yung safety ng pasyente. So, I just hope, Anonymous, yung nagtatanong, na naintindihan mo yung aming explanation ni ma'am. Okay.
That's why documentation is very important, no? Kasi in case of litigation, the court will ask for the patient's chart, no? And you know, I know that some hospital would would change, no? The documentation pagka merong mga uh, sentinel events, no?
Tama, ma'am.
Okay?
Oh.
So very careful with your documentation because a simple comma can be a lawyer's delight, no? Kasi ang comma will change the context of the sentence.
Tama
Okay?
po. I agree, ma'am. So yung sentinel events, yung mga nagkakalkal pa sa Google kung ano yun, that's an event that either potentially leads to injury or death. So it's as broad as that. So yung nangyari na naka-injure sa pasyente or nag-result sa kamatayan ay tinatawag na sentinel event. Ayun yung pangyayari. Just to make it simple. May tanong, nakakatawa naman to. What are your favorite subjects and how did you manage to ace them? Yung favorite subject ko is my lowest rating in the board. Because nagbasa ng maraming libro, I got confused. So my least favorite, which is CHN, I got the highest rating in my board. I got a 94. I'm proud of that for my CHN. Pero bakit ganun, sir? Kasi sa sobrang ayaw ko ng subject, isang libro lang yung binasa ko. Yung pala mas effective yun. Kasi nagkaroon ako ng sense of focus, naka-reflect ako dun sa binasa ko. So, hindi ako nalito. So, yun nangyari sa akin. That's why up to now, when they ask me, is this your favorite subject? You got a very... Hindi talaga. But how come? You have a very high rating. Kasi sabi ko, isa lang yung binasa ko dyan. Which I remember, I have a sibling who also was a board top notcher. Pero, ang nangyari naman sa kanya, ayaw niya ng ethics. So, yung sa kanya, buti ako, nagbasa pa ako ng isang libro eh. Yung sa kanya, hindi talaga siya nagbasa dahil ayaw niya yung subject. So, what happened was, yung lahat nung ang layo-layo ng agwat niya doon sa ibang examine sa lahat ng subject, pagdating doon sa ethics, nabawian siya lahat doon. So, you can see how if you hate one subject, it could actually affect your performance. So, if I were you, wag na tayo mag-favorite subject or wag nang gano'n. Basta aralin na lang natin siya lahat para para mas maganda yung performance. So wala na ako sasabihin na dapat may fini-favorite tayo. Okay? Wala pa daw ba ma'am Magna Carta for the NLE? I don't know anong ibig sabihin niya sa Magna Carta for the NLE.
Yeah, what do you mean by that?
Yun. Baka Magna Quarta. Magna Quarta para sa healthcare workers, maganda yon. Marami tayong kwarta. Marami tayong kwarta. Alam ko meron ng Magna Carta sa healthcare workers, matagal na yun, 90s pa eh.
Yeah.
Oo, meron na yun. To Ma'am Arquisa daw po, is this the last time po na old framework ang exam?
Yeah, I think so. Because supposed to be beginning this June, the framework would have been yung CMO number 14, which is the present BSN curriculum. Kasi it started in 2018, so 19, 20, 21, 22. That's why actually we have announced noon na by May, because usually the NLE is given May, June, no? May, June, and then the second one is November, December. So yung May, June supposed to be will be using yung CMO number 14, no? Pero I think the board was not able to disseminate it to the ADPCN. Although I think they were expecting that ito ng CMO number 14, yung learning outcomes na ang framework. But it is still, do not worry, no? Kasi yung example na we gave you, no? As you can see, na-integrate yung key area of responsibility, but the examples are outcomes-based. No? Okay? Yun lang ang problem kasi ngayon sa examination, dapat mga outcomes-based ang question. So dapat ganito yung mga question ngayon, no, sa future NLE, no? But we have harmonized naman the 11 key areas of responsibility with the 14 learning outcomes, no? Because we are now using learning outcomes for the outcomes-based education. And then we use the term learners for pupils or for students. No? Okay, and then we are using mentor for the teacher, mentor, coaches, and the like. Okay? No?
Ma'am, sagutin ko lang po ito. Is prescribing medications malpractice or negligence? I get different answers po kasi sa instructors. Okay, siguro yung nagtanong nito, dapat alam mo ano yung konteksto. Kasi sa Amerika, meron tayong tinatawag na nurse practitioners. They can prescribe medications. So it's not malpractice. Okay? So pag nurse, malpractice lang pinag-uusapan. Okay? Okay. So yung unlicensed, doon tayo mag-uusap tungkol sa negligence. Okay? So, ngayon, pag nandito sa Pilipinas, ang konteksto, hindi part ng nursing practice natin yung pag-prescribe ng medication. So, therefore, malpractice dito sa atin yon. Okay, and then iduktong ko na po yung isang nagtanong, ano daw ba ang difference ng NCLEX sa NLE? Nako, mahabang diskusyon yan. If you want to know about it, I can discuss it to you kahit nakapikit ang mata ko historically. Siguro ako lang nag-iisang nurse sa Pilipinas na ang hilig ay mag-take ng NCLEX. I have taken it when it was paper-based. I have taken it when it was first computerized. I have taken it when they introduced innovative or alternate items. And now they have the next generation NCLEX. So, malayo po. NLE talks about the common causes of mortality and morbidity within the context of the healthcare of the Philippines. When you talk about NCLEX, it is about patient issues and evidence-based practice answers to those patient issues in the Western world. So, magkaiba tayo. Kaya nga sinasabi ko, pag nag-aral ka para sa NLE, kunwari, Parkinson's disease, pinag-aaralan mo pathophysiology, diagnostic test, signs and symptoms. Pagdating sa Amerika, sa NCLEX, patient issues ang pag-uusapan. Like, pwede bang mag-bike ang may Parkinson's? Pwede ba siyang kumain ng tsokolate? Ano bang sapatos ang kanyang pwedeng gamitin? And the answer should be evidence-based. So, hindi siya pwedeng culled from books. Kasi yun sinasabi ko, learning theorists have suggested that the half-life of knowledge has shortened to 18 months. So by the time na graduate ka, 4 years in nursing, obsolete na lahat yung alam mo. That's the reason why now for the different state boards, they recommend that you take the NCLEX within 2 years after graduation. Kasi if you don't, lahat ng alam mo, wala na. Kasi ganon kabilis magbago ang knowledge. Kasi nga evidence-based na. So whatever is proven more effective takes the first level of evidence that's usually adopted in terms of nursing practice. Katulad ng example. Dati, nung panahon ko, sabi ko nga, ang turo sa amin, kaya nga minimemorize, M-A-N, mouth and nose. You suction the mouth of the baby before the nose. Ngayon, ang nakalagay sa level of evidence, you need not do that kasi may natural clearing reflex ang newborns. So, hindi mo na kailangan i-suction. I-wipe mo na lang yung kanilang mouth and nose. So, mali na yung isasagot mo. In the very same way, nung panahon namin, anong enzyme ang nag-elevate pag may MI? CK ang sagot. Kasi yung pa lang naman yung na-discovery noon. Hindi pa na-discovery noong 97, 98, na-discovery na ang troponin. And then nung 2001, na-discovery na ang myoglobin. So ano yung pinaka initial ngayon na nag-i-increase? Myoglobin na ang sagot. So kaya nga minsan tinutokso ko ang estudyante, your answer represents the year you graduated. Kasi nagbabago. Hindi natin sinasabi na mali yung sagot mo. Tama yan kung ipinanganak ka in the past. Okay? Sa henerasyon natin, tama yon. Yun yung sinasabi ko. So, yung mga nagsasabi, let me take this time to correct the notion na, ay, pag pinasa mo ang NLE, basic din lang ang NCLEX na ko. Yan yung usually unang-unang bumabagsak. Bakit? Pagdating dun sa international test, iba ang framework. Ibang-iba from what we have. And that's the reason why you need a bridge to get to where you want. Okay? So, ang dami-daming testimonials sa YouTube channel ko. Pumapasa sila by just watching my YouTube channels. Ang dami-dami nurses as far as South Africa, Cameroon, kung saan-saang lupalop. I'm receiving a lot of emails every week from nurses who said, bakit libre lang to? It has to be kasi ang ganda-ganda ng content, and it's, to me, masarap lang ipakita sa mundo anong kayang gawin ng Filipino nurse educators. And you are free to navigate through my YouTube channel. Kung ang exam mo ay HAAD, DHA, Prometrics, I have all sorts of videos there, and that's actually for free. Ayan. Tapos, itong ibang tanong siguro, masasagot na to ng PRC website kasi may nagtatanong, paano daw ba mag-file for first-time test takers? Naku, si ma'am pa ba ang sasagot yan? Pwede mo na yung i-search sa website ng PRC. Okay? Yung mga ganun naman na level ng question, huwag natin itanong kay ma'am. Si ma'am talaga dapat higher level yung tinatanong natin sa kanya. Okay? Katulad nito, need pa daw pang pumunta sa PRC. Naku naman, hindi tinatanong yan kay ma'am. Okay? That is just very technical. need pa bang pumunta sa PRC? Kahit sabihin naman namin na hindi na, kung ang bagong policy nila, you need to go there, we can't do anything. Okay? Please just call PRC for these concerns. Okay?
Alright, may isang question po tayo dito. I think this is for Ma'am Arquiza. Is it true, ma'am, that when the top one gets a high mark of 89% or more, then there is a chance that the passing rate would be low?
How's that?
Ma'am, kung mataas daw po ang rating.
It's not true, no, because it depends on the overall results, no, and we look at we do item analysis, for example, no, and usually we get the mean, no, we get the mean for every test, no, and so there are 5 tests, no, so yung average, minsan kasi ang average is it may si Sir Ray, ano mo, kasi top notcher si Sir Ray.
Ma'am, kasi ganito, meron ako dating kakilala na ang sinasabi niya sa mga ganyan daw na exam, usually, they base it, tama si ma'am, yung mean, median, at saka after that, they deliberate. Di ba ma'am,
Yes.
ganun yung proseso. Baka ang gusto nilang malinawan, ma'am, ay do you get as a test taker, do you need to get 75 to get a rating of 75? Baka yun ang gusto nilang malaman. So, to me, I think ang sa statistics, from the point of view of statistics, depende sa ina-adapt kasi na proseso ng bawat sistema yan, di ba ma'am? And usually naman, ang Board of Nursing as an independent body, sila yung nag-a-adapt ng kanilang specific system. Okay? Like for example lang po, kung ang napag-usapan, if you get 70, pwedeng yan ang 75, equivalent ay 75. Ay ina-adapt nilang ganon. Oo, pero hindi laging nakasalalay kasi yung kanyang thinking is standard deviation yun, ma'am. Yun yung grading system namin nung araw sa UST na lahat na lang nakadepende sa kung sino yung highest saka yung lowest. Okay.
Highest,
So
lowest.
hindi necessarily na ganon sa board exam. Okay? Tapos may nagtanong po dito, okay? Yun daw po bang CMO for the board exam, baka daw po special area na or specialty area na ang coverage. I don't think, di ba ma'am, ang framework is nurse generalist ang outcome natin. Huwag kayong...
Beginning practitioner.
Yes.
No? Beginning practitioner.
Oo, si Madam Melissa.
Walang specialty, walang mga advanced, no? Of course, there are advanced knowledge, no? Pero hindi yung advanced practice, no. The test really, the framework is the CMO of the BSN curriculum. So, ano yung napag-aralan nyo for the 4 years, no? Okay? So, probably doon lang sa research, minsan, no, like qualitative, for example, hindi masyadong nakukuha yan sa undergrad, di ba? Di ba? Mostly quantitative yung inaano natin, no? Yung we do quantitative studies, no? There are few schools who are doing qualitative studies for undergrad. That's why, but I think with the new CMO, parang tatlo na yung research. So, yung isa is for qualitative research, I think. Now, like for example, sa CPU, they have quantitative studies and then qualitative studies. No, parang hinahati nila. Now, I thought of that when I was Associate Dean of the Institute of Nursing of FEU. I was the one implementing the curriculum, no? So I thought of doing or giving a test, no? Giving a test to students so that uh, we will know sino yung magaling sa numbers. We will let them do a quantitative study. Kung sino yung magaling sa, magaling sa numbers, no? Sa math, for example. So they can do quantitative study. Kung sino yung magaling sa language, halimbawa English, we will let them do a qualitative study. Pero it's quite expensive because yung test, you have to, you have to pay for the test, no? Uh, and with so many students during that time, it will be added cost. But it could have been a very good strategy for the students to love research, no? Kasi yun nga, kung magaling ako sa math, I will go quantitative because numbers. No, pero pag magaling ako sa English, qualitative, or sa writing, I'll do qualitative study. No? Okay?
Ang ganda, ma'am. So may tanong po dito, sabi, Ma'am Glenda, nagra-round off po ba sa average ng exam? For example, 74.61, hindi po ba pasado na yon? Ay, meron lang akong reaction dito. There was a time nung in the 90s, ma'am, pag nag-release ang PRC, kasama ang rating sa dyaryo. So it's there for all the world to see. Yeah, that happened before. So wala pong 0.61. Wala pong ganon. So it's 0.2, 0.2, 0.3. So it's 74.4, 74.6, 74.8, ganon siya. Wala siyang butal na 0.61. So
Yes.
siguro ina-apply niya, ma'am, yung rule na when an even number is followed by an odd number, you have to round it to the nearest. Walang, ayoko lang, ikaw, ma'am, ang may karapatang sumagot niyan. Meron po bang ganon na rounding off ng scores?
Wala. Walang ganun.
Sabi ko nga.
Like for example, if the board decides na, yun nga sabi ko, to lower it to 2 points or to make it higher by 2 points, no? Ang pasado kasi 75, no? So whether yung nakuha mo halimbawa is 73, no? Pero after deliberation, pumasok ka doon sa pasado. So lahat ng pasado, 75 ang 75 ang grade.
75 flat. Apo. Okay. Salamat po, ma'am, for that answer. Ito, may sikreto daw po ba ng pagpasa? Ako, ang suggestion ko, mag-aral. There's no other way. You have to comprehend the questions. That's the only secret that I can share on my own. And then, yung tanong niya, this is too detailed na. Per exam po, ilang correct answers po para pumasa? Diba sabi ni ma'am kanina, ito ay may deliberation sa PRC. Oo. So, after the test nila nalalaman yan, they are guided with the statistician. So, inulit lang po, ma'am. Okay. Paano daw ba mag-top ng board exam? Kailangan you want it. Ako, pinagplanuhan ko yan, lahat ng ginagawa ko. Outcome-based ako. Pagpasok ko pa lang sa nursing school, kahit na hindi ko first choice ang nursing, in-envision ko talaga yung sarili ko that I will be a board top notcher. Yun talaga yung goal ko. So, nasa mindset mo yun eh. And then dapat lahat ng gagawin mo naka-align doon. If I may share, second year pa lang ako noon sa UST, nag-gather na ako ng review materials ko. Third year pa lang ako noon, nag-volunteer na ako sa university na ako na lang tagabuhat ng projector ng mga reviewers para makapasok ako dun sa review class na sinasabi nga ng mga fourth year, anong ginagawa ng insektong bata na ito at bakit nakikialam dito sa review class namin. But ang mindset ko is I have to do this kasi hindi ko naman gusto yung nursing. Pero may goal ako. So I have to do something to love what I'm in. Oo, kasi ang gusto ko nun talaga maging broadcast journalist. Kaya ang daldal ko eh. So, siyempre, nursing ang pinakuha sa akin. So, I have a goal. I have to differentiate myself. So, gumawa ako ng paraan. Paano ako makakalibre sa review? O nung araw, mag-volunteer kang taga-bitbit ng projector, taga-bura ng blackboard. And that's how my professors knew about me. Itong batang ito, ano to, may gustong mangyari sa kanyang ano. So it's a long-term process. There's no shortcut to achieving one's goals. Hindi po pwede na matulog ka hoping na mapanaginipan mo kung ano yung mga pag-aaralan mo. Hindi ganun yon. It is a conscious effort to do something so that you can achieve what you want. So long-term yan. Oo, hindi natin sinasabi na too late na. Hindi. Uh, Meron ka pang mga ilang araw, no? So you can still do something. Oo, yung may anxiety on the board exam, okay? Tapos nag-pandemic daw, hindi natapos ang mga subjects, okay? Ano daw ang recommendation? Learn through YouTube, internet, okay? Kunin mo yung CMO, tignan mo yung anong required na topic doon, magbasa ka on your own. Kaya nga ngayon, hindi na ako naniniwala na magpapaskill ng top-notchers specific for a school or a center. No, I don't believe in that anymore. The top-notcher is an accomplishment of the person alone. At no one can claim na yung knowledge niya ay galing lang sa eskwelahan niya. Kasi ngayon, ang learning nag-diffuse na. Hindi po pwedeng kahit nga yung handout ng kunwari, isang school A, napupunta na yan sa school B because there are communities of learners and community of inquiries that are informal but are formally addressing the needs of the learners. So ibig sabihin ngayon, nag-fuse na ng knowledge, hindi katulad nung araw. Ipinagdadamot mo ang handouts mo kasi syempre galing ka kunwari ng UP, galing ka ng USA, ayaw mo makita ng iba. Ngayon hindi na uso 'yon. You can download everything for free kahit galing Harvard yan, kahit galing Pennsylvania University yan, kahit saan. Meron ka ng pagkakataon. So, na-democratize ng knowledge. Kaya hindi na ako naniniwala na ang basehan ng kagandahan sa board exam, mas maganda yung ginawa nila sa bar exam ngayon. They clustered the performance of the lawyers. So, pass, outstanding, exemplary. So yung exemplary, pag 90 and above, I think 14 lang ang exemplary. Pag 85 to 90 ang rating mo, ang nakalagay sa certificate mo, outstanding performance. Pagka below 85 ka, pass na lang ang nakalagay. I think that's better kasi rather than we are trying to binabraso natin ang bawat isa dahil gusto natin mag-number 1. We always rank ourselves. Pag tinignan mo yung edukasyon ng mga Japanese, they are taught to work together. Kaya walang honors, etc. Walang rank 1, rank 2, rank 3 sa kanila sa basic education. They are trained to work together. And if we do the same, I think hindi na issue yan. Ang issue, ma'am, kasi sa may board rating, I just would share my sentiments. Meron akong kaibigan sa isang maliit na community. Tight yung kanilang katunggali niya na mag-chief nurse. Nung dalawa na lang silang naiwan dahil pareho silang marunong na. Ang ginawang pang-break na yung board rating. Itong isang kaibigan ko, kahit napakarunong niya in terms of people skills, hindi nga niya sineryoso nung na-board exam siya o nag-diarrhea siya. Di 75 ang rating niya, hindi napunta sa kanyang posisyon. Now, my point is, why should I be judged for something that happened in the past? If I have become a better professional, I should be taken for what I am now. So, pag outcomes-based na rin lang pinag-usapan, sana wala na lang rating. I-abolish na yung rating system. Okay? Anong reaction ninyo, colleagues, na mga nakikinig? Do you agree na outcomes-based na, wag na lang mag-rating para pagdating ng panahon that you become better, hindi nagiging baggage yung mababa mong board rating sa promotion. Sabi nila, ma'am, super agree.
You remember, Dr. Ray, di ba, yung competency-based, it's supposed to be passed or fail lang di ba? No?
Yes, ma'am. It's
Walang
supposed to be
rating,
pass or fail. Wala pong rating.
May standard, pero
yes, ma'am. Pwede nating i-adapt yung parang sa bar exam na ginawa nila outstanding, exemplary, and then pass.
Although sa nursing, di ba, ano naman, yung for 50 takers and above, ito yung outstanding performance. pero it's different
Oo,
pa rin.
ma'am.
Oo.
Oo, ma'am.
Kasi,
Ma'am, kaya lang
ah,
yung sa nursing, ma'am,
yeah,
school-based po tayo.
yeah,
Yung
school
ginawa
day.
po ngayon, ng sa bar result, individuals. Kaya yung kanilang outstanding performers, more than 700 ang makaka-receive ng citation.
Oo.
Oo, kaya ang ganda. So, hindi, kasi ang sa atin, ma'am, it's very limiting. Yung
Yeah.
top 10, kung 15 lang yun, di 15 lang yung na-recognize. Kung titignan mo, ang konti naman ng, yung pang 11, konting points na lang yun eh. If we cluster them,
Yeah, totoo yun.
di ba ma'am, if we cluster
Yeah.
them, di mas maraming na-acknowledge o na nakakapanghinayang yung pang 11, wala na siya certificate. Whereas, yung ginawa sa bar exam, natuwa ako. Kasi parang more than 700 yung ni-recognize nila with the certificate of outstanding performance and exemplary performance.
Yeah.
So wala na siyang number, ma'am. Ayan. Ang mga questions ay nakagraduate ng mga senior high school, tinuro daw bago ang curriculum. Totoo ba na nag-iba ng ano? Totoo ba na mag-iiba na ang mga questions sa susunod na NLE? Kasi daw nakagraduate na. The senior high curriculum has nothing to do with what the board exam is all
Yeah.
about. The board exam is based on the CMO related to the curriculum in nursing. Okay?
Yes.
Oo. Yung mga ganun, wag na. Okay.
And the
Ma'am,
requirement
ang
is,
bongga daw po ng kuko nyo.
and the requirement is, uh, the individual should be a graduate of Bachelor of Science in Nursing in a recognized government recognized institution, no? So yung high school, senior high, hindi. Although merong sila ano yung track, may science, health science track ba yun? So tama si Dr. Ray na hindi. It should be based on the nursing law, no? So yung CMO number
14 ba,
14,
ma'am? Yes, ma'am, 14.
pa yung
Opo.
sa susunod CMO number 15 na.
15 na. Opo.
Yung OB, yung new curriculum.
Ma'am, ito po, kailangan daw po ba ng RT-PCR or antigen test kahit fully vaccinated? I think pag fully vaccinated na, hindi na. Just the full vaccination card would suffice.
Yeah, just just check with the latest bulletin from PRC, na? Or from IATF. Pero para sure sa PRC.
Opo. Ito pong tanong na ito, I think ma'am nasagot mo na kanina to kasi ito yung opening statement mo. Yung difference ng old framework from the OBE framework. 'Di ba? Sabi natin yung OBE framework is the old framework is based on the 11 key areas of responsibilities. Yung OBE is based on the 14 key outcomes ng ating curriculum. So once again, once again, itong nagtatanong, if you are a board examinee, you don't have to differentiate the two. Your concern should be just to be informed about what framework is to be used for this test. And sabi ni Dr. Arquiza kanina, it's gonna be the old framework, meaning the 11 key areas of responsibility na diniscuss niya. Yon. Okay. And then,
so you look at the description ng nursing practice 1, 2, 3, 5, no? 1, 2, 3, 4, 5. Ang practice 1 is community health nursing, right? Then practice 2
yes, ma'am.
is maternal child, no? OB pedja. Ang practice 3 would be med-surg A, practice 4 med-surg B, ang practice 5 med-surg C. No?
Okay po.
Ang practice 5 would be psychiatric nursing, musculoskeletal, and then
ENT, ma'am.
ENT, and then neurological. Yung
Yes,
nursing practice 5. Yung 4 and 5, med-surg yun. So I don't know, yung yatang gastrointestinal is ang gastrointestinal sa 4 yata or sa 5 ang cardio. Basta anyway, ang safe quality care is integrated doon sa 5 nursing practice, no? So yung 11 key areas of responsibility is integrated din dito, no?
Yes, ma'am.
So merong that's why merong kanina nakita ko na naman na ang dami daw research. Marami talagang research. You expect at least 25 questions on research, no? 25 questions on documentation, no, records management, and quality improvement, kasi itong 11 key areas of responsibility, ano yon, integrated yon sa lahat na test. Na?
Ma'am, ito, alam ko ikaw makakasagot nito, pero napapasmile po ako nung binasa ko. Is it true that in some questions, correct answers are based on the greater the number of examinees who chose a certain answer, and that is considered the correct answer?
No, it's not, no, but you know, there are cases wherein ang answer is walang answer, no? Walang answer sa option. That's why we have bonus, no? Bonus question, pero limited lang sa 2. No? Sa 2 bonus question. And then kung wala talagang answer or kung ang construction ng sentence is not understandable, then we disregard it. So minus yun. So sometimes 99 lang, no? 99 out of 100. And then 98 out of 100, no? Pero hindi doon sa item analysis, it is done after na kasi, no? So
Thank you,
hindi
ma'am.
that's why pagka may doubt doon sa answer when we deliberate, no? Kasi there are sometimes, you know, there are answers na yung nagawa hindi tama yung answer niya. there are instances like this. So we deliberate, no? So we look at the where did you get that question, no? So dapat yung the one who developed the question, she would be able to defend the answer, no? Okay, so we agree, no? It's usually an agreement. No, oh yes, this is a better option than this one. No?
And if I may share, ma'am, my personal experience nung araw. Kasi nung time namin, darating 1 to 50 items, mainit-init pa, minimimeograph pa nung araw eh. Antay namin yung next 50. Tama po yung sabi nyo na nagiging bonus kasi nung time namin, instead na lugol solution, naging dugol. So may typo error. So I think yun, pag naapektuhan na yung presentation ng question, tama po kayo, nagiging bonus. Meron din po nangyari na na-cut. Siguro sa pag-mimeograph, instead na A, B, C, D, A and B lang yung options, wala na yung C and D. Eh, ang mga proctors noon, ang copies nila ng test paper, sakto lang nung panahon namin. So, kung 30 lang kayo sa classroom, 30 lang yung sheets nila. So, hindi ka pwedeng makitingin sa... So, lagi na lang sinasabi, let's report, let's report. So, tama po, siguro na clarify nyo that it becomes bonus. Ito naman po, sasagutin ko po yung tanong dito. Is it true that erasures can really affect your Scantron sheet? Hindi lang erasures, even the quality of the pencil that you use. Sabi ko nga, ayoko manira ng brand, but we did an experiment kung anong lapis ang pinakamaganda dahil nare-read siya ng Scantron. Okay? So I will not mention the name of the pencils na hindi maganda ang rehistro, but if you will send me an email through Health Carousel, I'll send you the answer dun sa experiment namin na yon. Pero it's true that the quality of the pencil and the erasure may affect. Yun dun sa experiment namin, one erasure can cause a 3 to 5 points deduction from the Scantron reading because it damages the other shading dun sa yung quality ng papel. Okay? Paano po mag-review pag sa book na binasa, iba-ibang mga books ang nakikita? Normal naman yan. So, when you review, you just choose the best book that you can use. Okay? And then, wag masyadong madami so you don't get confused. Si Ma'am Glendang kailangan sumagot nito. Totoo po
That's
ba?
why, you know, when I was new in the board, no, I recommended to ADPCN that they should have common references, no? 'Di ba? Doon sa CMO nila kasi, they have the resource units. And then I suggested you should have common references so that ang playing field is fair, no?
Ma'am, I
We
agree.
can do, we can get questions from those references because we are sure na lahat ng eskwelahan nagagamit nitong reference na ito.
Ma'am,
But I don't know
ma'am, I agree. Kasi ma'am,
Yeah.
yung aking kapatid na sa dentistry siya, napakaganda nung kanilang, meron pa silang pre-exam reference sheet. Naka-enumerate doon ang official references. Kung merong problema sa question, sa answer, doon lang sila magbe-base. Kasi ma'am, sa atin, even normal values, different books would say different things.
Yeah.
Okay?
Totoo.
Oo, ma'am. So magkakaiba. So ang
Oo.
hirap-hirap na ngayon, lalo na yung mga mahilig lang sa mga Google documents na magaganda naman.
Yeah.
So iba-iba. So sana nga, tama po kayo dun, ma'am. Sana nga mangyari yon. Okay? And then, posible po ba na yung mga present daw natin kanina, ma'am, ay lalabas daw sa exam? Well, siguro punta tayo sa Quiapo. Okay? Mag-ask tayo, magpabraha tayo doon kung totoo nga yun.
You
Those
know,
questions are
issues,
just...
excuse Doc Leia,
Apo.
there are issues now and the PRC is investigating it. They are selling NLE questions sa Lazada and Shopee, no? For as much as 1,200, no? I tried to buy sa Shopee. Ewan ko kung kung na-deliver na, parang sinabi it will be delivered parang
Ma'am,
after
parang
2
ang mali kasi doon, ma'am. Ma'am, sana kasi ang Shopee, pag walang copyright registration, yung nagsisell, hindi dapat nila pinapayagan. Kasi nagiging
pero
mechanism pa sila eh. Opo.
Totoo yun, no? That's why yun nga, you go to a legitimate review center, no? At least legit, no? Like Gapuz, no?
Ma'am, ano din, ang ginagawa po kasi natin minsan dyan ay we try to simulate the field, di ba? Yung combination of questions based on the framework. And then, of course, magda-download ka ng mga tinatanong ng mga estudyante sa Google, and then you try to figure things out, how to present it. Yun pwede yung gawain. Pero siguro, ma'am, nung araw kasi sa CGFNS, may primer, ma'am, ang CGFNS noon eh. 2 libro. Pag binasa mo yon, the topics that they cover in the primer are the same as that they cover in the actual exam, but not the actual questions. Just the topic. So kung matyaga ka na magbasa ng primer, and then pag-aralan mo each topic, you read, hindi mo na kailangan pumunta pa sa test preparation center. Kasi ako on the learner's perspective ako. Number one, the economics of things right now na pandemic, that's why we're doing a lot of free sessions, is because halos wala ng budget yung iba. Okay? So ngayon, ang pwede natin gawain is to become a little more facilitative and then give them a sense of focus. Kasi ang nangyayari ngayon, sa dami ng pinapansin ng mga estudyante, hindi na nila alam kung alin talaga pag-aaralan. Okay? And then, totoo po ba ma'am, na pag hindi daw pumasa ngayong May, ay kailangan na daw mag-refresher? Yun ba ma'am ang pamantayan?
No,
Mm-mm.
na even, and we have a case na 14 times na siya nag-take, no? Hindi pa rin nakapasa. No, but anyway, there is no provision in the nursing law or there's no resolution of the Board of Nursing that after failing for 3 times mag-refresher course na. No, it did not push through. No,
Mhm.
there were some initiatives regarding that, pero under the nursing bill, nandoon na yon na pag hindi ka nakapasa for for 3 times, no, you will have to take refresher course. Pero as of now, hindi pa. Ha? Okay?
Okay, so hindi pa. Yun daw ang sagot. So
Yeah.
ngayon, pa-email, yung brand ng pencil na dapat gamit. Yeah, yung maganda ang rehistro sa Scantron. May 2 o 3 brand naman na maganda yung rehistro. At meron ding 2 na, yung isa nga, halos hindi ma-read ng Scantron ang kanyang lid shade. So, pero sabi nga natin, I would rather send you sa email yung mga magaganda. Wag na yung hindi nababasa at baka tayo sabihin, naninira tayo ng brand. Yung mga magaganda na lang yung isi-send ko sa inyo sa email.
So, paki-email po
Okay?
kami para
Yes.
masabi ni Sir Ray
Oo.
yung
I-email
brand.
namin through Health Carousel. Sabi nila yung daw nagsagot ng evaluation, yun yung sisenda ng email nung sa pencil brand. Okay. So you have to answer the evaluation. Pati daw yung lecture, 'di ba? We promise na yung students copy ng slides namin ni Ma'am Glenda will be sent after. Yes, we will comply po. Okay.
All right. So that was the last question that we have. So thank you so much everyone for asking, and thank you then for Dr. Glenda and Sir Ray for answering yung mga questions natin for today. So everyone, would like to remind you na to fill out our post-evaluation form, and thank you then sa mga nag-fill out. So now, before we end our webinar today, we'd like to present a certificate of appreciation to our speakers.
All right. So, certificate of appreciation to Dr. Ray A. Gapuz in grateful acknowledgement of his invaluable knowledge, values, and expertise in the webinar entitled NLE Masterclass Session 1 NLA Quick Fix Concept held on April 23, 2022, signed by our president, Ms. Marivic Doctor. And of course, certificate of appreciation to Dr. Glenda Arquiza in grateful acknowledgement of her invaluable knowledge, values, and expertise in the webinar entitled NLE Masterclass Session 2, Understanding OBE Type of NLE Questions, held today, April 23, 2022, signed by our president, Ms. Marivic, Doctor. All right. So, guys, thank you very much for joining us today. And siguro gutom na yung lahat.
Thank
Ang
you.
dami
Thank
nating
you. And good luck and God
natutunan.
bless.
Thank you. Thank you,
correct.
sir.
Luck
Yes,
to
we hope
everybody.
we hope everyone would we were able to help everyone prepare for their upcoming na licensure exam. So we wish you luck, and we hope to see you more sa mga webinars natin from Health Carousel, and good luck. Thank you so much for being here with us today. For sure, marami tayong passers. So for
Yeah.
the upcoming licensure examination, mag-comment kayo. I will be a registered nurse. Let's claim it.
Yeah.
Thank you,
Thank you,
everyone.
everyone.